The coronavirus crisis. According to former FDA Commissioner Dr. Scott Gottlieb, the new, more infectious COVID-19 variant will account for the majority of U.S. coronavirus cases by March. The new variant, which was first found in the United Kingdom, has already popped up in 3 U.S. states, and China has reported its first case of the new variant. Joining me now is NYU Langone Medical Center pulmonologist Dr. Qanta Ahmed. Dr. Ahmed, you are concerned about this new variant. What can we, but the treatment isn't any different. It's just more contagious, correct?
That's right. And in fact, it was first identified in Britain in September, but very rapidly by December had impacted 62% of all people that were infected. So it seems to spread very rapidly. It's not causing more severe disease. It's not causing any different manifestations. But as you can see in California, when there's a very large spread of disease, it puts enormous demands on the health system. And I agree with Scott Gottlieb that that's very likely. In fact, as I heard about the new strain in Britain, I wondered if that was what was going on in California. Britain measures and monitors the genomics, the real-time genomics, the gene architecture of the virus much more closely than most other countries. Since June 2020, they've identified 140,000 different variants. So it's not unusual that this virus has changed. In fact, this coronavirus changes less often than the influenza virus. So we're used to viruses changing, but it may mean that we're going to have more demands on our healthcare system.
Just watching what is going on out in California, Dr. Ahmed, it seems, though, that lockdowns, again, aren't stopping the spread of it. And it's very easy to blame people for not using careful behavior. But it's astonishing to me that these state and local officials are literally repeating the same things that they did in the spring. And again, it's not working.
So, Dakin, you bring up a very difficult challenge and a sensitive point. There's certainly data to show that's been published in journals like the Journal of the American Medical Association that household transmission, the ability for us to catch the disease inside our households with our families, can be as high as 16%. That's because they're close spaces, people are having conversation, they don't have PPE, and it's a highly contagious virus. So I do believe that the lockdowns cannot arrest necessarily the spread in the way that many local authorities hope. Also, if you are poor, if you're socially disadvantaged, you're more likely to be in more crowded accommodations. And from those communities are many essential workers that are in low-level frontline work that then also have to go to the community and come back. So the lockdown is an extremely blunt tool. People have got very comfortable using it, and they're not thinking about the economic ramifications, which also have huge public health impact, including death, suicide, mental illness, psychosis, rise in domestic violence, rise in child abuse, rise in other substance abuse, terrible things that are happening because of the lockdown that is actually promoting social inequality while it also propagates transmission. Now, we do have to wear masks, clean our hands, and I think this may put enormous pressure on our ability to vaccinate Americans. I'm sure somewhere at the apex of government, there are discussions as to whether California should have a much faster rollout of the vaccine than other places because of the problems that they're seeing. And certainly we have this vaccine amassed in the United States. We've only given 3.5 million doses. Not even 1% of the population is vaccinated, unlike Israel, which has already vaccinated 11% of its populace. Our private pharmacies, our private chains, whatever they're, Walgreens or Duane Reade or any of these, can vaccinate 100 million people a month. They do every year. We vaccinate 170 million people with the flu vaccine every year. Maybe that's what we need to engage now and not wait for later.
Well, over the weekend, Mark Levine, he's a New York City council member. He's chair of the health committee here in New York City. Vaccinations in New York City are only happening during regular business hours. There's very little that's going on the weekend. I mean, that is just an abomination to me. That because there are pandemic vaccination plans that were put together for, say, in case of a biological weapons attack, say smallpox,
Right.
where literally in 72 hours, the goal would be to vaccinate the vast majority of, say, the population here in the city. And they're treating this like, I don't know, that it's a candy giveaway. It's really disgusting.
Dagan, you bring up a very important point. And in fact, smallpox vaccination here in 1947 in New York, within 2 weeks, we vaccinated millions. I think, if my memory serves me correctly, 7 million people within 2 weeks in 1947. And yes, I've been very shocked. I'm absolutely blessed. NYU Langone very quickly vaccinated its workforce. We're going to be very close to vaccinating everybody within a few weeks, and that's over 50,000 employees. But at the same time, and on this network, I broadcast that private practice doctors in New York had no mechanism for getting the vaccine. And we had to speak about it regularly on air before the governor recognized and announced today is the first day non-affiliated doctors, people that are seeing floods of the public being tested for the coronavirus, actually having a mechanism to be vaccinated. So this is a failure at state and local government. They love to scapegoat the federal government, but this is absolutely a failure of the state and local government. And in fact, Pfizer has announced they have almost 35 million doses of vaccine sitting around waiting to be vaccinated. If the state and local government cannot get this done, let the pharmacies do it. It's very frustrating as a physician who has patients that are afraid of the disease.
Right.
I have elderly parents that are waiting for the vaccine. To see this happening, we're awash in the most precious resource in the world at the moment, and we have not a mechanism to deliver it.
Dr. Qanta Ahmed, good to see you, and I apologize for mispronouncing your name the first time. Please come back. It was great to see you, Dr. Ahmed. We'll be right back.
Pleasure, Dagan. Happy New Year.
You too.